Winter can bring on a whole new set of challenges, including mental health struggles. Now that it gets dark out so early, you may notice a change in yourself and others. But don't worry, there's help. And here to tell us more about how Overlake Medical Center can step in is Overlake's lead mental health professional, Nicole Babwin, and supervisor of psychiatry service line, Kevin Mongot. Thank you for being here, y'all.
Thanks for having us.
Thank you.
Nicole, I want to start with you. What is a common mental health challenge people face during the fall and winter months? So really right now.
Right, especially with the lack of daylight, the weather. We see a lot of patients that present with anxiety, depression, not wanting to sort of do normal daily activities and just needing some additional help.
Definitely. It makes sense. And we were talking about this, when I'm driving into work, it's dark outside. And then when I'm going home from work, it's dark outside. So you don't really always feel that motivation to work out and do kind of your daily activities. How do people sometimes cope with these feelings? And what are the risks of using substances to manage mental health symptoms?
Yeah. So what we see often is that patients will present with what we call co-occurring, which is mental health and substance use. And most of the time, patients are using substances to cope with the mental health. And so we address it with the patients and treat both of them at the same time.
Yeah. And Kevin, I want to get to you. So what treatment options does Overlake offer for people that are experiencing these issues?
Yes, we have outpatient and inpatient services. For outpatient services, currently we have openings in our partial day hospitalization program, which is essentially our PHP program, it's called abbreviated. We help with group therapy, medication management, helping with coping skills to help deal with life stressors as well. And we can be referred by calling our number directly on our website. And also our inpatient facility is a 14-bed voluntary inpatient facility called the Behavioral Health Unit at Overlake. We provide crisis stabilization. And side note, for any crisis, please go to your closest emergency department. That's when you can be referred to any inpatient facility in the state of Washington. And if the social worker or mental health professional deems you fit for our facility, they'll refer you to us as well.
Gosh, great information there. And Nicole, back to you. What role do mental health professionals play in helping patients really manage their symptoms?
Yeah, they're a really important role in helping patients. In the inpatient treatment program, we have 5 groups a day that mental health practitioners lead and teach coping strategies. And also in our outpatient program, our mental health therapists meet with patients individually to really work on coping strategies and medication management.
Yeah, that's all great. And Kevin, how can someone get help or just learn more all about these services? Because it's a lot that you all have gone through today, and I know people can be a little overwhelmed. So where can they go?
Yeah, for our resources, you can be referred to our Overlake website, and you can find the direct lines to call and just be referred.
Yeah. And Nicole, back to you. I want to know just any key takeaways that you want people at home watching to know about what's going on with, the big dark, and when to see somebody if they're feeling some of these symptoms.
Yeah. Oftentimes, sometimes family members will see signs and symptoms in their family and call for help, and also patients that, just are really having a difficult time with sort of daily life skills. And so, we encourage patients to come to any emergency room if they're feeling those mental health issues. Mm-hmm. And then we screen the patients, and then if appropriate, we refer them to inpatient treatment program. And then our goal really, while they're an inpatient, is at getting coping strategies, seeing our psychiatrist every day, and really providing outpatient treatment options so that patients have a continuation of care once they leave the hospital, so that we really provide ongoing structure for the patients.
So the care doesn't stop just when you're there in person, it continues on.
Yeah.
That's awesome. Yeah. Any takeaways too, Kevin, that you want people to know at home that you want to add?
Yes, we're here to help. So if you need support, don't hesitate to reach out for help. We have with community resources along with going to your close emergency department for any crisis as well.
Amazing. Thank you both for being here today. I really appreciate it.
Yeah, thank you.
And to learn more about Overlake's resources, you can visit the website that you see right there on your screen.
New Day Northwest is sponsored by Overlake Medical Center and Clinics.